Hello and welcome to our topic of female reproductive system. We're going to do this in two parts just like we did for males. So we'll just kind of cover in the first section the anatomy of the female reproductive tract and function, and then we'll get into the microanatomy and the ovarian cycle and uterine cycle in the next video. All right, so let's go ahead and get motivated.
Did you know that the United States has the highest rate of sexually transmitted infections among developed countries? Sexually transmitted infections, or STIs, are the most common disorders of the reproductive system. Since over 12 million Americans contract STIs each year, it is highly likely that you will encounter some of the most prevalent STIs in your patients, including gonorrhea, chlamydia, the human papillomavirus, and herpes. As a healthcare professional, it is very important to educate your patients on their reproductive health. In order to do this effectively, you will need to understand the underlying infectious agents, modes of transmission, and symptoms of the most common STIs. For example, gonorrhea is caused by a bacterium that is spread by contact with the mucosal surfaces of the reproductive system. These bacteria invade the mucosa of the reproductive and urinary tracts. Since gonorrhea is caused by bacteria, it can generally be treated with antibiotics. However, if left untreated, gonorrhea can cause significant complications like infertility in women and inflammation of the entire male reproductive tract. Having a solid understanding of the anatomy and physiology of the reproductive system will enable you to recognize symptoms of reproductive disorders like STIs, give you the ability to treat your patients with STIs, and educate all of your patients on ways to maintain a healthy reproductive system.
Okay, so the big three for the sexually transmitted diseases or sexually transmitted infections. We have gonorrhea, which is, like you said, is a bacterial infection. This one is rapidly becoming antibiotic resistant, so there's a scary thought. The number one is going to be chlamydia as far as number of new cases that are reported. And chlamydia often can cause pelvic inflammatory disease because it often is asymptomatic. And so that can cause infertility. And then syphilis, which used to sort of be an old-timey disease, it wasn't very high, is now making a resurgence, particularly in the men that have sex with men populations. And then also it can be transmitted from mother to child. And so Texas is number 4 in congenital syphilis. So not a great stat for us. So just to sort of remind you of the functions of the female reproductive system, just like males, the gametes have to be produced, so we're going to make eggs. So ova is the anatomical term for eggs. They're going to have to secrete the female sex hormones, so estrogen and progesterone. Receive sperm, provide a site for fertilization, implantation, development to term, facilitate parturition, which is labor and delivery. And then we're talking about it in the sense of caveman, cavewoman. We're going to make cave kid later. Provide nourishment for young via mammary glands. So we're not going to get into gender roles for anatomy and physiology. All right, so this is the female reproductive tract. And so the ovaries are that primary sex organ. So it's going to make the gametes. So the female gonads, they're going to make gametes and produce hormones. That production of the eggs is going to be through oogenesis, that's just meiosis in women. And then the sex hormones are estrogens. There's estradiol, estrone, and estriol. We're just going to collectively call them estrogens. And then progesterone is the other female sex hormone. The secondary sex organs, these are structures that are essential for all aspects from fertilization to parturition, and then also for post-birth care. And so we're going to go through our structures and talk about their functions. But the breakdown is the uterine tubes are going to provide that site for fertilization. The uterus with the cervix, development of the embryo and then the fetus, so the human. The vagina and the external genitalia, that is for copulation, so for coitus, for intercourse, and whatever words you and your friends came up with. The vagina is also the birth canal. Then post-birth, the mammary glands are for nourishment. So in this talk, I'll talk about the breast anatomy, but then I won't discuss lactation until we make cave kid. All right, so think about a woman's body. A A woman's body prepares for pregnancy every month, whether a woman decides to conceive or have children or not. And then think about it, the uterus is the womb, and it has to grow and stretch and accommodate a human being. Other things that are sort of different between male and female anatomy is that these are the ovaries, and then this is the ductwork called the uterine tubes or the fallopian tubes, and they are not connected. So that means we have to do some things. We have to make sure that all these parts stay in place, and then two, that they can stretch and move and then accommodate that growing fetus. And so there's going to be some port ligaments. And so I don't know about you, I have fixed a lot of stuff with duct tape in my life, but that's always what I think about. And so there's going to be a lot of support ligaments to make sure everything stays where it's supposed to, and like I said, accommodate the changes that are going to occur as that fetus grows and moves. And so when you look at this, you see these little, looks like a little angel's wing. Yeah, they're not. That's the broad ligament. And so think about if you had to build the female reproductive system, like for a science fair project, you'd want to make sure that none of your organs were going to move around. And so the broad ligament is basically, it's a tenting of the peritoneum, and it's going to enclose all the other ligaments and organs. And so it's going to support the uterine tubes, the uterus, and the vagina. So think of that like the duct tape. These are the ovaries right here, and they are not attached to the ductwork. And so they're going to be attached to the uterus, and this is going to be through the ovarian ligaments. And so it's just going to anchor them medially. And then think about it. We're going to look at a slide that's going to actually looking down into the pelvic bowl. And so the next ligaments are called the suspensory ligaments. And so they're actually going to suspend and anchor those ovaries laterally. And so right here too, encased in that suspensory ligament, that's where we're going to have our nerves, arteries, and veins that are going to basically be feeding the ovaries. There's another ligament called the round ligament, and this is going to be homologous to that gubernaculum that sort of guided the descent of the testes. So for this talk, I'm going to use that term homologous structure a lot. And this is because the reproductive organs in both men and women are derived from the same embryological tissue. And so in a male fetus, it's going to be testosterone that's going to bring about the masculinization of both internal and external genitalia. In the female, it's just an absence of that testosterone. So this round ligament goes out through the inguinal canal and goes up over that pubic ramus, just like the gubernaculum. And so it has a very important job, and that is to maintain what's called anteversion. So you see the uterus down here, see how it's tilted forward. And so this is important as that fetus is developing to allow room for this mother's digestive organs. And so what can happen as a woman ages, and then two, with multiple births, this round ligament gets stretched and it doesn't really recoil. And so what you end up with is what's called uterine prolapse. And so this uterus, it loses its anteversion and then it can sink down into the vagina. So that's called uterine prolapse. And so it's a very important ligament. And then our last one is called the uterosacral ligament. So it's right here, and it kind of tells you what it is. It's anchoring the uterus to the sacrum. But all of that is just to keep everything in place. And so here we are looking down into the pelvic bowl. And so you see the uterus, you see the uterine tubes, then you have the suspensory ligaments, and then here are the ovaries, and they're attached to the uterus through the ovarian ligament. This round ligament, I don't really like this picture because it would be going up and over that pubic ramus, and then those fibers are going to spread out into the labia majora, which is the external genitalia. And so then it's just showing you that white, that broad ligament is just going to kind of be that tenting of the peritoneum that encases everything. Okay, so let's just get an overview of our organs.
The female reproductive system includes a number of parts. The ovaries hold the eggs, which are released each month during childbearing age. They also produce sex hormones, which control periods. The fallopian tubes connect the ovaries to the womb, also called the uterus. When an egg is released, it travels down the fallopian tube towards the womb. At this time, sperm from the male can pass into the fallopian tube, where it may meet the egg and fertilize it. fertilized eggs pass down the fallopian tube to the womb, which holds and protects the baby during pregnancy. The lining of the womb is called the endometrium. It thickens during the menstrual cycle, ready for pregnancy. If you don't become pregnant, you have a period, which is when the lining sheds. The cervix is the lower part of the womb. It is the opening into the vagina. During a period or menstruation, blood passes from the womb through the cervix and then to the vagina. The vagina also opens and expands during sexual intercourse and stretches during childbirth to allow a baby to come out. On the outside of the body is the vulva. It is made up of 2 pairs of lips. Between these is the opening of the vagina. Above the vagina is the urethra, the short tube that carries urine from the bladder to outside the body. And above the urethra is the clitoris, a very sensitive area that gives sexual pleasure. For more information about cancers that can start in the female reproductive system, go to CRUK.
Okay, so it's time for us to color. So go ahead and get your structure function sheet. If you need to take a break, go ahead and pause me, but go ahead and get your colors out because we are going to go through it. Alright, so our primary sex organs, like we said, are the ovaries. And so they make and release 1 ovum per month. And it is presumed that they are going to alternate, first the right, then the left. They really don't know, but they presume that they do. And the job of the ovaries is to make estrogens and progesterone. And so these are the uterine tubes. They also are called fallopian tubes. That's after Gabriel Fallope, if you want to call them fallopian tubes. In veterinary science, often they are called oviducts as well. But the big function of this is the site of fertilization. It is also an open passageway to the uterus. It is lined with mucosa, and then there's smooth muscle that is going to move by peristalsis towards that uterus. And so there's also going to be cilia. We'll look at the lining in a minute. But the uterine tubes move the, ideally, conceptus, if we're trying to make cave kid, towards the uterus. This part of the uterine tube is called the ampulla. It's quite wide. This is usually where fertilization occurs. And so the ampulla can be about, when I say wide, about 6 millimeters. And then there is a very narrow place called the isthmus. And so that's about the width of a human hair. And so we'll talk about some problems with that. So we're going to talk about pelvic inflammatory disease when there's STIs that are untreated, what that can cause, and then STDs. Like I said, you get scarring of those tubes, risk of ectopic pregnancy. But I'm going to click to another slide for that. So just go ahead and color your uterine tubes. Don't color these little fringe. They are a different structure. They're part of the uterine tubes, but they have their own name. So those little fringe parts are called Fimbriae, and if you colored them, don't worry about it. Just attach it to your label. And so their job is to sweep that oocyte when it's released at midday in a woman's cycle. It's called ovulation. And their job is to sweep that oocyte and make sure it gets into the uterine tubes. All right, so here we are just looking at it from a different angle. So we have our ovaries, primary sex organs, make and release 1 ovum per month at ovulation, about day 14 in a woman's cycle. And then these Fimbriae, their job is to sweep that into the uterine tubes.
Ovulation is a part of the menstrual cycle when the ovary releases a ripe egg, or ovum. Inside the ovary are hundreds of thousands of follicles. Each follicle is a hollow ball of cells with an immature egg in the center. The typical 28-day menstrual cycle begins on the first day of menstrual bleeding. During the first 7 days of the cycle, a few follicles begin to grow at the same time. These maturing follicles secrete estrogen hormone into the bloodstream to prepare the lining of the uterus for pregnancy. Around day 7, all of the follicles stop growing and begin to degenerate, except for one. This dominant follicle continues to grow and nourishes the developing egg inside it. Around day 12, the follicle secretes a large amount of estrogen into the bloodstream. When the estrogen reaches the hypothalamus and the pituitary gland in the brain, the anterior or front part of the pituitary gland releases a huge surge of luteinizing hormone into the bloodstream. Around day 14, luteinizing hormone causes the follicle to undergo a sudden growth spurt. Right before ovulation, the egg detaches from the inside of the follicle. The bulging follicle releases chemicals, causing one of the two fallopian tubes to move in closer and surround the follicle. The follicle swells until it bursts open, ejecting the egg and fluid from the follicle into the abdominal cavity. In response, the Fimbriae, tiny projections at the end of the fallopian tube, sweep across the ovulation site and pick up the egg. Microscopic cilia on the Fimbriae surface transport the egg to the entrance of the fallopian tube. Inside the walls of the fallopian tube, muscular contractions gently push the egg towards the uterus. After ovulation, the egg lives for 12 to 24 hours, so it must be fertilized by a sperm from the male during this time for a woman to become pregnant. If it's not fertilized, the egg dissolves away and is shed along with the uterine lining during menstruation.
Okay, so this is looking at the mucosa of those uterine tubes. And the mucosa of this tube is really, really folded. And then if you look at these cells, there are two different populations. Some of them are ciliated, and just like we watched on the YouTube. So they are rowing, and they are rowing towards the uterus. The idea is we're going to get conception in the uterine tubes, and then we have that little conceptus has to make its way to the uterus for implantation and for development. And so we've got these cilia rowing. These cells right here are called PEG cells. They're actually going to be secreting things like glucose and amino acids and other nutrients and electrolytes to basically moisten and nourish the egg, the sperm that are coming in, and then if there's conception, then that conceptus as it makes its way towards the uterus. So the problems with the ductwork not being connected, we just learned about STDs. One of the problems with STDs is there is a really narrow place right here called the isthmus. And so STDs, what they can do is they can scar this area just through chronic inflammation. Many STDs are going to be asymptomatic, particularly in women. And so when we have sperm, they're deposited in the vagina, they make their way through the uterus, through the uterine tubes. Fertilization normally occurs here, and then the conceptus makes its way. So a lot of times what's going to happen is anytime you have implantation of a baby, so of a conceptus, anywhere other than the uterus, so anywhere other than the lining of the uterus, it's called an ectopic pregnancy. Usually this is going to happen in the tubes, right there at the isthmus, being a tubal pregnancy. Perhaps you've heard that term instead. And so it can also occur outside, because if you think about it, this ductwork is open, so the egg is released, maybe it didn't make it in the uterine tubes, and then the sperm swim out into the peritoneum, and then it gets fertilized. So you also just can you basically get that implantation anywhere in that peritoneal cavity as well. And so that's called ectopic pregnancy. Ectopic pregnancies are not conducive to the life of the mother, nor the life of the conceptus, so the life of the baby. So this pregnancy, ectopic pregnancies, have to be terminated. Other things, so STDs, since this ductwork is open, a woman can get what's called pelvic inflammatory disease. So that is when the causative agent of that STI, so whether it's gonorrhea or chlamydia, is now out in that peritoneal cavity. And so that's called pelvic inflammatory disease. And two, like I said, once again, you're going to have inflammation, you get scarring and closure of those uterine tubes. It's a major cause of infertility. It's estimated that about 26,000 infertilities per year are caused by pelvic inflammatory disease. How common is it that the oocyte or that egg doesn't make it into the uterine tubes? They think about 1% of the time that this fertilized egg is not going to make it into the tube. or there's going to be fertilization, outside of the womb. So ectopic. That's pretty common. All right, so we have the ovary, the fimbriae, the uterine tubes. And so this whole thing is the uterus, but there's 3 layers to it, so color them separately. So the innermost layer is called the endometrium. And so this is the layer that's going to grow and is shed monthly, so during menses or menstruation. And it is going to grow and be shed in response to ovarian hormones. And we'll talk about that in the next talk. So let's talk about the endometrium. So there's something called endometriosis. So this is a painful disorder in which endometrial tissue grows outside of the uterus. So think about it. So now I just told you that this uterine tube is open. And the idea is when the endometrium is shed during menstruation, that's all supposed to flow out. But what happens often is retrograde flow. So you get basically this uterine lining is going to go backwards, and it can go back into the pelvic cavity, and those cells can attach, and then they can also just respond to those ovarian hormones, and they can grow and be shed again. Usually a woman's macrophages, her body's going to take care of this, but sometimes that doesn't occur. And so what's going to happen is these cells, like I said, they're going to respond to ovarian hormones. So it's just going to cause a lot of pain. It can cause sterility just because of the cycle, that growth and the shed and that inflammation. And so once again, that can lead to ectopic pregnancies or infertility. All right, so the uterus, we've got the endometrium, and then we have the myometrium right here. And so that is going to be that smooth muscle layer. And so this is a layer that's going to contract during childbirth to expel the baby out through the vagina, the birth canal. So endometrium, myometrium, and then the outer part is going around it. So that's called the perimetrium. And that's an incomplete outer serous layer tenting of the broad ligament. And so the uterus, the big function of it, it's the site of implantation. So that's when a woman is officially pregnant. When there's implantation, she has an embryo. And then just for development. So the uterus is the womb. All right, so just pretty much everything I just said. So endometrium, cyclical changes, shed through menstruation every 28 days, smooth muscle, contract. Yep, there it is all for you in text form. So looking closer at that layer though, so think about the endometrium. It's going to grow and get shed monthly whether there's a pregnancy, whether a woman plans on becoming pregnant or not. And so there's 2 parts to the endometrium. So the stratum basalis, this is the basal layer, if you will, and that's the layer that's going to stay and regrow every month. And there's a layer that's shed called the stratum functionalis of the endometrium. And so this is showing the blood supply. Oh, there we go. Blood supply going to that functional layer. And so these are called spiral arteries. And so it's going to be due to a drop in progesterone. These spiral arteries, they're going to expand and contract, and basically they're going to get sloughed off. And like I said, the idea is then that this layer will be shed. So this part right here, so remember your cervical region is the neck. The neck portion of the uterus is called the cervix. And the cervix is going to secrete mucus, one, to block off entry into the uterus, because if a woman hasn't ovulated, there's no reason to let anything into the uterus. There's nothing to fertilize. And other than at mid-cycle before ovulation, that mucus is going to thin. This mucus also is going to lubricate the vagina. The cervix is also where a pap smear is taken, so that it's an external os and an internal os is the opening of the cervix. And so now we're looking, as if we were looking into someone's vagina, here is that opening. And so this is what a healthy cervix looks like. And then this is a cervix with carcinoma, so cancerous cells. And so a pap smear is when they go in and they just take a scraping or a sampling of the cells from that opening, so from the cervix, and then they would send that off to a pathology lab. And so cervical cancer, very common cancer in women, and so I'm gonna let these ladies tell you all about it.
So the human papillomavirus, it's a very common virus, and it's estimated that approximately 80% of women are exposed to the virus at some point during their lifetime. Fortunately, the vast majority of women are able to clear their virus through an intact immune system. But it's the smaller proportion of cases, a very small proportion of cases that the women are unable to clear the virus. It leads to HPV persistence. And the pathway, the carcinogenesis pathway, it takes many, many years to develop into a cervical cancer. And on average, it's probably about 10 to 15 years. And that's why screening is so important, because we can intervene before a cervical cancer even develops.
So the vast majority are HPV associated, and only a tiny fraction, like 1% or so, are not related to the virus. There are about 15 different types that are associated with cancer. Not all HPV viruses are associated with cancer. And as Dr. Lee said, the vast majority of women clear this spontaneously without needing further treatment. That said, for those where the virus persists, and the populations who are at highest risk are those who do not have an immune system that's intact, whether it's because of HIV, or chronic exposure to steroids, or other cancer treatments. In these women, the risk of it progressing over a long period of time is high.
Yep. All right, so let's talk about cervical cancer. So it affects nearly 450,000 women worldwide, killing about half of them. So that's the big thing with cervical cancer. It's quiet. Often women, unless they are being screened through a pap smear, they don't know they have it. So half of them die. It's the number one fourth cancer affecting women, most common between the ages of 30 and 50. And so like I said, that big risk is that human papillomavirus actually causes genital warts. And in most women, there won't be any symptoms. And just like that video says, it's cleared from the body, but it is a persistent viral infection. And so it can lead to cervical cancer. There is now a vaccine, so a vaccine that could potentially eliminate cancer. So it could actually cure and eliminate cervical cancer. It's called the Gardasil vaccine. It's given in 3 doses. And it's recommended for both boys and girls. Recommended they need to get it before they're sexually active, because HPV is so prevalent in society. If they've already had sex, they've probably already been exposed. And so that pap smear, and this is the guy's name. It was named after nope, you can try that one. It's recommended every 3 years for ages of women 21 to 30, and then every 5 years for older women. Once a woman has had a hysterectomy, she no longer needs to have a pap smear, because usually they just remove that and don't leave the cervix necessarily. All right, so making our way through. So now we have the vagina. The vagina is the copulatory organ. It's also the passageway for menstrual flow. It's also the birth canal. It has folds for accommodation. So we have those rugae again. The secretions, the walls actually seep or through exudation glycogen, so to secrete sugars. And there are bacteria, resident bacteria there, lactobacillus, that are then going to take those sugars and create lactic acid. So the pH of an adult woman's vagina is right around 4. And so this is a protective measure, so that primary immune defense, keep them out. In adolescence, it's more alkaline, so that microbiota isn't established yet. And so adolescents, they can get pregnant easier, and they're more susceptible to STDs because they just don't have that acidity. Down here, there's a little dash mark. That's the hymen. So the hymen is incomplete vascular mucosa, and it's going to be very variable. We're going to look at that in just a second. So may or may not cause bleeding during first coitus. So let's talk about the vagina. Let's talk some more. So the vagina is about 3 to 4 inches long. It is a fibromuscular tube. Think about what it has to accommodate. So the passage of an infant. It's going to be stratified squamous for friction. It's going to have rugae to accommodate stretch. A lot of elastic tissue. There's really no mucus glands, there's no goblet cells there. So secretions are going to come from the cervix and then vestibular glands, which we'll look at. It's an acidic environment. There's a smooth muscle layer, outer longitudinal, inner circular. Smooth muscle contracts during and after coitus to keep the pool of semen close to the cervix. It has an outer adventitia, so just outer fibrous elastic connective tissue that's going to just keep it in place, support it, merge with that of the bladder anteriorly, and then the rectum is posterior to the vagina. All right, let's talk hymen. And so the hymen is just this incomplete mucosa, vascular mucosa at that distal end. And so it can be, here's all the variations of hymen for you. And so if I did a polling, and what research says is only about 40% of women actually bleed during first coitus. Some women, they can actually be born and it's called imperforate, and then a doctor would just sort of, it's not even surgery, would just sort of slit this and open it up. So yes, you can have your virginity restored. They're actually plastic surgeons that will repair a woman's hymen. But think back in certain cultures, if you didn't bleed during first coitus, that meant you weren't a virgin. So back in history, women would send their daughters with small vials of blood to protect against repercussions by the groom's family for not being given a pure maiden. Okay, so homologous to the bulbourethral gland. So once again, coming from the same embryological tissue, this also sort of has the same function. So these are called the vestibular glands. And there's a right and a left, but we can only see one in this picture. And so they're going to secrete a lubricant at arousal that's going to moisten the entryway, if you will. That's called the vestibule. So like I said, homologous to the bulbourethral gland in males. And you can see it's right there by that urogenital diaphragm. So very, very close to the same location. So let's look at external genitalia. So it's collectively called the vulva. Anterior to the pubic bone is a fat pad, so it's called the mons pubis. We'll label it in your diagram. The lips, so labia means lips, so the larger lips, so the skin folds with hair. They have both types of sweat glands are called the labia majora. And then right here, these are called the labia minora. And so the labia minora, if you look at their boundaries, that makes up the vestibule. So this whole area right here is called the vestibule. And so what's inside of the vestibule, the entrance hall, we have the openings to the vestibular glands. So order goes clitoris, urethra, vagina. We're not having that lab exam in class per se, but sometimes women miss that. So just thought I'd help you out with that order. And I may ask you that order on your exam, so anterior to posterior. And then, of course, the clitoris is for sexual pleasure. It has tissue homologous to the penis, so erectile tissue. So the clitoris is actually homologous to the glans penis. We'll get there. All right, so for coloring purposes, so right here, the fat pad is called the mons pubis, and that's for cushioning and for comfort. Once again, if sex were not enjoyable, sex makes babies, we just all hang out and eat pizza together. There's the clitoris, and once again, it has a large part of it that is going to be internal. And like I said, it's hard erectile tissue, high concentration of nerves for sexual pleasure. Okay, so the male, if you remember, there are two types of erectile tissue. There were the corpus cavernosa, and then there was the corpus spongiosum. And so females have that homologous tissue. And so the body of the clitoris is going to be that hard erectile tissue. But underneath the labia, there's also what's called the bulb of the vestibule. And this is also erectile tissue, so more like corpus spongiosum. And so when a woman becomes aroused, this becomes engorged, and then that will help grip the penis. Because once again, if there's not enough stimulation and there's no ejaculation, we can't make cave kids, so we need to have that. And so this is just showing those greater vestibular glands and how they're going to secrete that not in a woman, that secretions for arousal to lubricate that vestibule. So homologous structures mean it came from same embryological tissue. Sometimes there's an overlapping function. Yep, just kind of trying to remind you of those erectile bodies in the male. All right, so just for coloring, we're almost done. So labia minora, that makes up the margins of the vestibule. Those are the lips without hair. Anterior, we're going to make up the prepuce of the clitoris. And then the labia majora, that is going to enclose and protect the urethral and vaginal openings. And so that's going to be homologous to the scrotum. So just regular skin with pubic hair, and then both sebaceous glands and sweat glands, both types, apocrine and eccrine. So put off those pheromones. Okay, so just female sexual response. It is not required to make cave kid, but it certainly helps in relationships. So it's going to follow the same pattern as in males. So arousal, so that's going to be parasympathetic, innervation, erectile tissue, the bulb of the vestibule, and the clitoris. We're going to become engorged with blood. The vagina actually is going to expand and elongate, and there are going to be increased secretions from the cervix, and then also from the walls of the vagina. And then vestibular glands are analogous to those bulbourethral glands, so provide that lubrication. And then, like I said, secretions from the cervix. So then there's enough stimulation that there's a flip between the autonomic nervous system. It's going to be a reflex. So a sympathetic nervous system, once again, there's going to be a release of oxytocin, which is going to cause pleasurable, smooth muscle, rhythmic contractions of the perineum, the uterus, and then the uterine tubes. Okay, so I'm going to stop here. Don't forget to upload that to the appropriate D2L Dropbox and come back for part 2.